This is my title for the talk today. I really appreciate being invited. I think it looks like a great conference. Sorry I haven't been able to attend the first portion of it. Oops. Let's see how I can advance a slide. There we go. So I don't have anything to disclose. I have obviously been involved with climate and mental health issues through a number of groups, including my representing the APA and the AACP on the steering committee of the Medical Society Consortium on Climate and Health. So lots of learning objectives. I will zip through them quickly. At the end of this program, I hope you will recognize the reality of the climate crisis and its impact on health, the psychiatric conditions and other mental health impacts that emerge from or affected by the climate crisis, that we recognize the psychological factors that contribute to the refusal to acknowledge or that are involved in disavowing the reality and the urgency of climate change, that we recognize the immediate and urgent mental health and public health impacts, that we recognize the ethical and public health duties for us as health and mental health professionals to speak out about these threats and to advocate for rational and effective policies to address those threats, that we understand the roles that psychiatrists and other mental health professionals and health professionals should perform in facilitating the recovery from and the immediate and the longer term disaster related phenomena. We want you to become motivated to have opportunities to determine how to prepare for and to work to mitigate, prevent, and reverse mental health consequences of climate change. I want you to become aware of the available resources to facilitate such public health and mental health activities. And we want you to recognize how climate change is a major social determinant of health and mental health, and that building community resilience is a key component in the public health and mental health effort to address the health risks of the climate crisis. So I'll start with a case presentation. A patient shows up in the emergency room with life-threatening symptoms. She's a 4.5 billion year old female who goes by the name of Gaia, although some call her Mother Earth. She has experienced relatively good health throughout her life, although she sustained and survived a few serious infections, the last of which was about 66 million years ago, so-called dinosaur extinctitis. Then about 150 years ago, she developed the onset of a fever of unknown origin. This was followed by a number of accumulating symptoms over the next 100 years, including sweating, palpitations, respiratory difficulties, and abdominal discomfort. In the last 40 years, her symptoms have progressed steadily, and she is now having much greater respiratory difficulty, worsening fever, edema, intermittent episodes of urticaria, and excessive flatulence. These progressive symptoms have coincided with the onset of self-destructive, cruel, and short-sighted behavior of some of her children, who have severely damaged their own home and livelihood in their reckless pursuit of immediate gratification and accumulation of wealth and power. In other words, social determinants of their mother's health. Her vital signs and lab findings on admission are very troubling, with markedly elevated temperature, fluid overload, electrolyte imbalance, dramatic alteration of her gut and skin microbiome, onset of septicemia, lowered pH, and markedly elevated CO2. Her mental status exam reveals a mature, pleasant, and loving woman who's quite distressed nonetheless, with extremely depressed mood and suicidal ideation, alternating with denial of illness and manic-like symptoms. She's being admitted to the ICU for further evaluation. Our patient, Mother Earth, reflects the situation we all face. Human-caused climate change is threatening the health of the planet and all its inhabitants. Continued dependence upon fossil fuels and large-scale animal agriculture create increased greenhouse gases, resulting in global warming. These health threats are urgent and extensive. They aggravate existing medical conditions and create new health problems. The health impacts range from mild and transient to severe, chronic, and life-threatening. So here we are, healers in charge of this particular patient, whether we're working from a general medical physical specialty area focus or as mental health providers. Because of the time limits on this talk, I'm skipping some things I otherwise share, which are about the overall climate and health connections. But this is an important slide to pay attention to. It shows the interconnection and interdependency of physical health issues, mental health issues, and community health issues, and how the geophysical impacts of the climate drivers, whether it's heat or sea level rise or wildfires or other kinds of extreme weather events, affect individuals' mental health, their physical health, and the social health. And all of these strengths and vulnerabilities that we can see combine to manifest, depending on how vulnerable or how resilient we are, the degree of impact that we see people having in terms of their health and mental health. Extreme, acute, and prolonged climatic events can create and facilitate a lot of different mental health impacts. The acute and chronic traumatic stress and somatic and neuropsychiatric impacts can contribute to a wide range of psychiatric conditions that we see occurring within the climate crisis, and as a result of it, and its combined impacts with other environmental and social factors and structural factors that we encounter. There are those that are direct with immediate effect, such as heat waves. They're indirect, but in the short term, but can have longer lasting impacts, floods, tornadoes, and hurricanes. And they're indirect in the long term, such as sea level rise, drought, deforestation, and mass migration. Now, this is a theme that's going to go throughout this presentation, that individual prevention and treatment is important, but system change is the greatest need. And we need to be thinking in terms of global and societal and community level prevention and interventions. So what are some of the mental health direct effects? And I'll also talk about some of the indirect effects. These include heat-related impacts, air pollution and anxiety, exposure to neurotoxicants, anxiety, mood, and trauma syndromes, and the impacts on children and youth. Let's start with heat. There's a lot of good data to show that increased heat waves in particular, can increase individual on individual and group on group violence. There's a rate of suicide increase that we see during heat waves. This has been noticed in various countries, including the United States and Mexico. The increase in risk of cerebrovascular illness, including strokes, has been noted. And then the important one that we need to talk about in terms of psychiatry in particular, especially in terms of folks who have severe and persistent mental illnesses, are the risks of dehydration, hyperthermia, and death, especially with people who have chronic illnesses and people with psychiatric illnesses at 3 times the rate of the general population in terms of their risk of dying. And why is this? It has to do in part because of their tendency to be less mindful about their exposure risks, to stay out of the heat or to stay inside, to remember to hydrate themselves. The other issue is the medications that we often use to treat people for psychiatric illnesses, and a number of other classes of medications, will interfere with the body's internal thermoregulatory function and therefore render someone less able to cool off in a time when they're exposed to heat. So it's important for us to advise patients to limit their exposure and to increase their hydration. And the Climate Psychiatry Alliance, which I'm a co-founder of, has a terrific website, including some toolkits for how to advise patients with posters and brochures and other information in regard to their exposure to heat. Air pollution and anxiety. There's a bidirectional relationship between respiratory distress and psychological symptoms. Think about anxiety and panic. And in one case, the chronic exposure to air pollutants can lead to increased risk and degree of respiratory conditions, and therefore greater risk of anxiety symptoms developing. People who have pre-existing anxiety can be exposed to greater risk of respiratory distress, especially if they're hyperventilating when they, say, have a panic attack. Neurotoxicants. We're primarily talking about the products of the combustion of fossil fuels, but there are other neurotoxicants that we find in the environment. Particulate matter and mercury and air pollution in particular, they lead to developmental disabilities in infants and children and cognitive impairment as well as in adults. A lot of neurotoxicants have been derived from fossil fuel and other sources of pollution, and they are present not just in the air, but also in soil and water. And they all can contribute to various neuropsychiatric conditions. There are increased infectious disease outbreaks in broader areas that can occur because of global warming, and these can contribute to cognitive impairment and movement disorders as well. And certain waterborne illnesses can lead to neurological impacts. The soil contaminants and increased CO2 in the atmosphere can lead to decreased nutritive value of grains and other food sources. And this has been shown in some really elegant studies around the world. And that leads to lower nutritive value in some of those grains when they're harvested. Again, the best treatment is prevention, the elimination of the pollutants, especially fossil fuels, which we need to keep in the ground. Anxiety, mood, and trauma syndromes have probably been discussed some during this conference. I'm not going to go into a lot of detail on them since this is an overview of the mental health impacts. But eco-anxiety is a term that many of you have heard. It's much more prevalent. The degree of worry, either extreme worry or moderate worry that people are manifesting, is well over 70% in the population in the most recent studies. Terms like solastalgia, ecological grief, pre-traumatic stress disorder, and depression related to environmental factors are becoming more evident. There was a piece in the Washington Post just last weekend that several of us were interviewed for that focused on the impacts of the Camp Fire in California. And the title of the paper of the article was "The Coming Age of Climate Trauma." Solastalgia is a term coined by an Australian anthropologist named Gerhard Albrecht, who defined it as kind of the anxiety and trauma symptoms that will emerge when people experience too rapid and too extreme of changes in their environment, and their sense of home is destroyed or modified in dramatic ways. Ecological grief is a term coined by a colleague of ours in Eastern Canada, Ashley Consolo, who described her work with Native populations, First Nations populations in Eastern Canada and in Australia, and how they and other people who depend on the land for their well-being and their livelihood and their cultural connections is very vulnerable when the climate changes and you can no longer go fishing or can no longer hunt on sea ice, and your ways of doing agricultural practices is dramatically changed. Think about the impact in Central America of the drought and the migration that we're seeing occur in part because of that. Pre-traumatic stress disorder is a term that many people are thinking should be ultimately included in DSM because of the anticipatory anxiety that people are experiencing, knowing the trajectory that we're on. Most people, though, who are affected by these feelings are not irrational. They are affected by overwhelming problems that they face in the environment. They have few impairments in functioning and therefore do not have psychiatric illness and don't need medications or psychotherapy unless they manifest some kinds of impairment. We should be aware of, and we have a network of climate-aware therapists. It's emerging through the Climate Psychiatry Alliance and the Climate Psychology Alliance. And I encourage anyone to go to either of their websites and sign up if you're interested in being a climate-aware therapist. It's important to have this kind of training that we're providing so you can be discerning in terms of who needs help and who doesn't. The first line of treatment really is to encourage people to get involved in corrective and collective activities at the community level to address the climate crisis and the various issues that are interconnected with it that relate to inequities in social and structural determinants and other factors that are listed here. There are lots of opportunities for social action. But there's also availability of emotional support groups that are not done by professionals, such as the Good Grief Network and climate cafes. Children merit a great deal of attention because of the impacts on them and the fact that they have a greater stake in what's going on because they have a longer future, we hope. And they're at higher risk for short and long-term impacts. Their sense of place in the world is under threat. Children's sense of community is under threat. Their sense of themselves is under threat. And they rely on their families to help them understand their experiences and feel better about themselves and their lives. Various conditions are created or exacerbated by climate factors, including post-traumatic stress disorder, depression, anxiety, phobias, sleep disorders, attachment disorders, and substance abuse, as well as cognitive impacts of exposure to air pollution and other neurotoxicants. These, in turn, can lead to other problems with emotional regulation, cognition, learning, behavior, language development, and academic performance. Together, these create predispositions to adverse adult mental health outcomes and decreased functioning as people get older. Children also exhibit high levels of concern over climate change. Meaning-focused coping can promote well-being and environmental engagement. Both direct and indirect climate change impacts affect children's psychological well-being. Children in the developing world will suffer the worst impacts. You're going to hear this term, the first and worst, repeatedly throughout this conference and in this talk in itself. Mental health professionals have important roles in helping to mitigate climate change, and they can research and implement approaches to help children cope with its impacts. And educating adults about how to talk to children about these issues is essential. I'm going to skip a couple of slides because of time. I'm going to go now to what we call the indirect and ancillary impacts, only a few of which I'm going to touch on today, but during the Q&A or discussion time with the panel, we might touch on some of the others. Transformational resilience as a community level public health intervention, I'm going to spend some time focusing on. Duty to warn, duty to train. I'll talk about those as well. Then there's duty to protect, the health sector's carbon footprint, and denial as a societal defense mechanism. Mass migration and its social implications, as well as the positive impacts of climate contact with nature. So there are social determinants of vulnerability that are defined as the degree of exposure one is experiencing, the level of sensitivity they may have, and their adaptive capacity. The combination of these things can contribute to the degree of vulnerability that someone would experience, or the resilience that they may experience, which would ultimately lead to the degree of impact of health problems that they would experience. This slide is busy, but it's very important, and I'm going to spend a little time on it. I call it the architecture of risk. I stole it from my colleagues Michael Compton and Ruth Shim's book on the social determinants of mental health. If you look at the bottom of the slide, public policies and social norms are what drives the degree of opportunity that people experience and the distribution of that opportunity that leads to the emergence of and the presence of a number of what are now called the social determinants of mental health. I'm going to read these because they're worth mentioning. The adverse features of the built environment, homelessness, poor housing quality and housing instability, low education or access to education, poor quality of education, adverse early child and life experiences and childhood maltreatment, neighborhood disorder and disarray or disconnection, food insecurity and poor dietary quality, unemployment, underemployment, job insecurity, discrimination and social exclusion, social isolation, poor or unequal access to transportation, poverty, income inequality, wealth inequality, exposure to conflict, violence, shootings, war, migration, and domestic violence is included. Poor or unequal access to health insurance or health care, area level poverty that's concentrated in neighborhoods a lot of times, interaction and involvement with the criminal justice system. And to top it all off, exposure to air, water, and soil pollution, and exposure to the impacts of climate change. These two were added to the original list that Michael and Ruth had developed in the first edition of their book, and it's included now. These social determinants together, which is often the case, if you have one, you'll have probably many of the other ones operating, unless in the rare case of someone who may be in a privileged position, but has experienced a lot of childhood neglect or maltreatment, may not have some of the other problems. These will lead to reduced options, behavioral risk factors, physiological stress responses, and psychological stress. leading ultimately to various poor outcomes, including health and mental health conditions. So climate change is real, it's immediate, and it threatens our health in many ways. It manifests through these various climate drivers that are listed on the slide, and these risks lead to acute and extreme events which have longer-term physical and psychological and economic, social, and political impacts that often will last longer than the acute events. These result in a wide range of physiological and psychosocial conditions. Many of them are substantial and long-lasting. And again, they affect those who are more vulnerable due in part to social inequities, the first and worst phenomenon. They require immediate, ongoing planning and implementation in efforts to combat acute and the chronic impacts. And it depends on a really broad participation within the health community of health, public health, and mental health professionals. But as you'll see, a broader community than that I'll describe in a moment. A vicious cycle can emerge. We can see hopelessness developing. The impacts of climate change can be exacerbating, and especially when they're exacerbated and poorly treated, and when people deny or disavow the reality of the environmental situation, can lead to a lot of disengagement and demoralization. And people can become more passive and hopeless. And that's something we have to be on the look for and try to reverse. Here comes transformational resilience. Although we recognize in many ways, in many states, the importance of preparing for and girding our communities for the effects of climate change, both by preventing further emissions, by keeping the fossil fuels in the ground and reducing our reliance on large-scale animal agriculture, we also need to see the infrastructure being hardened in terms of sea level rise and preparing for forest fires, changing our zoning ordinances so people aren't building in places that are more at risk. Beyond that, though, an equally important but generally unacknowledged phenomena is the need to have psychological readiness in the community, that we need to prepare the capacity of families and individuals and organizations and communities to cope with the adversities of climate without harming themselves or other people or the environment. These adaptive efforts that are called transformational resilience, or other terms for it, can also be catalysts to increase social, psychological, and ecological well-being. Now, traditional recovery from disaster methods are insufficient. The most harmful biopsychosocial spiritual impacts of climate disruption are due to the thing I just described: persistent, overwhelming, toxic stresses. These are not just the acute disasters, but now we're seeing cumulative recurrent events that are causing people to become more despairing. Even if we make essential changes soon enough to reverse some of the environmental impacts of the climate crisis, the psychological and psychosocial spiritual impacts will continue and will be the slowest to recover. So transformational resilience is a kind of comprehensive preventive intervention. It has to be launched throughout the world. We can create and sustain a good enough Mother Earth. This transformational resilience concept can prevent maladaptive responses by empowering all adults and youth to do the following things: to think and act in healthy ways, even in the presence of unhealthy conditions; to use these adversities as transformational catalysts to find meaning, direction, and hope in life; and to remain actively engaged and involved in constructive pro-social climate solution initiatives. There are two sets of skills or capacities that we're talking about: presencing, which is having the knowledge and skills and attitudes about the neurobiology of trauma and toxic stress, and to be able to regulate one's own reactions to situations; and purposing, things that would allow us to turn towards these adversities rather than avoiding them, and to be able to engage in post-traumatic growth resilience skills. Now, this requires the really broad community level participation to develop these kinds of opportunities for people to learn these skills. I'm going to shift now to talking about duty to warn. We as health professionals and mental health professionals in particular may need to be aware of whether or not we have an obligation to speak out about the risks of climate change. And I hope this conference is persuading you that it is important to talk to our patients about this and to use our credibility and visibility as health professionals to speak to the public and to political and policy leaders. There's a great paper that describes why one should feel that's worth it and it's justified to speak out. And it relates to the degree of expertise, the proximity of the issue, our effectiveness, whether there's some cost or risk to us as professionals to speak out, the unique role that we may have in doing this, the degree of severity of the problem, and how it affects or is affected by our public trust. And does such role responsibility apply outside of the provider-patient relationship? And I would argue that it does. These can be these criteria that I just mentioned can allow providers who face these challenges to decide whether we can take responsibility to protect people in the community who are not under our direct care by advocating for and supporting population health initiatives. Now, duty to train is something that we're doing today. We're engaging in, but in a lot of academic health centers around the country, at the undergraduate, graduate, and continuing education levels, people are developing curricular content. We're doing it at Oregon Health and Science University to try to train our medical students, nursing students, and other students of the other schools within the university to be aware of the climate and health connections, to be more motivated to be involved. We've got mandatory content that we've incorporated into our medical school curriculum and nursing school, and we developed a 10-week climate and health course, 1 week of which is all focused on the mental health impacts. There is a group called the Global Consortium on Climate and Health Education that's based at Columbia University in the Mailman School of Public Health that has a great set of resources on climate and health education initiatives, including mental health. And there's a terrific teaching tool that we've been using that you can, I think Bob or Wes can make sure that you get access to this link. It's the New England Journal has an interactive module on climate and health, and it's a terrific teaching tool. We use it as part of our curriculum at OHSU. As we think about what we as health professionals, as individuals and as healthcare organizations, whether it's clinical delivery systems or health professional societies, we have to be thinking of what's our overall agenda for how to address the health system's role and our role as individuals to address climate change. And we've, at the Climate Psychiatry Alliance, have come up with this acronym of CARE with 2 A's. First is clinical, that we need to understand, prevent, and treat the health and mental health impacts, participate in social cohesion events and initiatives, and facilitate community resilience and other public health initiatives. The administrative is the first A. We need to, at our clinic and hospital and health system level, reduce carbon utilization. We need to think about that also in terms of our research facilities. And we need to participate and prepare to respond to acute weather events and other disasters as part of the health system. As advocates, we need to disabuse denial. It's something we as psychiatrists and other mental health professionals have some expertise in understanding and responding to. We need to focus on divesting from fossil fuels, a very important preventive intervention. We need to develop and disseminate climate and health impact statements and calls to action. One of the most notable ones is called the U.S. Call to Action on Health, Climate, Health, and Equity. And we need to use our expertise and our credibility to advise policy leaders. Research. I've just recently did a presentation to a research town hall at OHSU, talking about what are some of the key questions and reasons why researchers need to be focusing on climate and health and climate and mental health questions. And finally, education. We need to provide the training that we're giving today and that we're trying to do in various academic settings around the country. So we've heard all this today. We're coming towards the end of this conference. And so many of the audience may be wondering, what if this is all for nothing? I hope that's not what you're feeling, but it could be. So here are the takeaway points. The mental health impacts of climate change are significant, they're current, they're expanding, and they will be the last to resolve even after we fix everything else decades from now. Health professionals have skills and obligations to participate in addressing these impacts. And climate change is the ultimate cross-cutting social structural determinant of health. It is a slow-moving mega disaster. And there are ample opportunities for constructive engagement and positive change for us and society. So Mother Earth is sitting in her ICU bed, and she has a word for us. And I want to bring it to your attention here. Hopefully this will come up, and let me know if it doesn't, James.
We see the browser. It looks good so
Okay.
far.
I'm making it full screen, and hopefully the sound will come on too.
Stop. Just stop. It is no longer a request. It is a mandate. We will help you. We will bring the supersonic high-speed merry-go-round to a halt. We will stop the planes, the trains, the schools, the malls, the meetings, the frenetic, furied rush of illusions and obligations that keep you from hearing our single and shared beating heart. The way we breathe together in unison. Our obligation is to each other, as it has always been, even though you have forgotten. We will interrupt this broadcast, the endless cacophonous broadcast of divisions and distractions, to bring you this long-breaking news. We are not well. None of us. All of us are suffering. Last year, the firestorms that scorched the lungs of the earth did not give you pause, nor the typhoons in Africa, China, Japan, nor the fevered climates in Japan and India. You have not been listening. It is hard to listen when you are so busy all the time, hustling to uphold the comforts and conveniences that scaffold your lives. But the foundation is giving way, buckling under the weight of your needs and desires. We will help you. We will bring the firestorms to your body. We will bring the fever to your body. We will bring the burning, searing, and flooding to your lungs that you might hear. We are not well. Despite what you might think or feel, we are not the enemy. We are messenger. We are ally. We are a balancing force. You to stop, to be still, to listen, to move beyond your individual concerns and consider the concerns of all, to be with your ignorance, to find your humility, to relinquish your thinking minds and travel deep into the mind of the heart, to look up into the sky, streaked with fewer planes, and see it, to notice its condition, clear, smoky, smoggy, rainy. How much do you need it to be healthy so that you may also be healthy? To look at a tree and see it, to notice its condition. How does its health contribute to the health of the sky, to the air you need to be healthy? To visit a river and see it, to notice its condition. Clear, clean, murky, polluted. How much do you need it to be healthy so that you may also be healthy? How does its health contribute to the health of the tree, who contributes to the health of the sky, so that you may also be healthy? Many are afraid now. Do not demonize your fear, and also do not let it rule you. Instead, let it speak to you. In your stillness, listen for its wisdom. What might it be telling you about what is at work, at issue? at risk, beyond the threats of personal inconvenience and illness. Stop. Notice if you are resisting. Notice what you are resisting. Ask why. Ask us what we might teach you about illness and healing, about what might be required so that all may be well. We will help you if you listen.
So we'll jump to questions and discussions now. And but before we do, I just want to leave you one last thought. A lot of people like to quote people, and I like to quote Albert Einstein, and to say that what applies to nuclear weapons now applies to climate change. He said the splitting of the atom, to which I would add the overextraction and consumption of fossil fuels, has changed everything save our mode of thinking, and thus we drift towards unparalleled catastrophe. But he also said intellectuals solve problems and geniuses prevent them. So let's all become geniuses. So thanks. I'll stop sharing and turn it back over to Wes and Bob. Okay.
Thanks, David. Very provocative. And, we have heard quite a lot today about the impending catastrophe of this whole situation. And we have kind of thought about the things that we do and are complicit in, furthering this catastrophe, and also some of the things that we might do to mitigate it. And we've certainly added to that. So at this point, I would like to invite people to make any comments or ask any questions that they have. I am just kind of looking at the chat here.
I don't think we have any questions at this point from the chat.
Okay. So, David, maybe we could just take a minute to hear a little bit about what drew your attention and your resolve around this issue. I mean, obviously, there's a lot of reasons, but I think we all kind of come to a point where we say, this just can't stand anymore. And you've certainly done that and devoted yourself to this. And maybe you could just say a few words about that.
Sure. Well, I've always been involved with environmental and political issues, for my whole adult life. And, certainly through the AACP, we've done a lot in that regard, recognizing the various intersectional issues that affect the health and well-being of our patients and our communities. But I was inspired in part by my daughter, who was an early involved in climate change activities over 10 years ago. And she guided us in some of the things we did. And then she had a child. So I have a granddaughter who's now 7. And thinking about what her future would be has really been a stimulus for me to say, I got to do more about this, and learning more and more about the climate crisis and the impacts and experiencing them directly. We've had 6 or 7 climate-related phenomena here in the Portland area just in the last year and a half. It's rather been stunning. Has kind of moved me. I recall talking about this 4, 5, 6 years ago, even within the AACP board meetings and conferences that we'd be at, and people looking at me kind of askance, come on, David, that's so far off. It's so in the future, and it's like in distant places. And it didn't take long for people to start going, wait, I think you're right. We should be doing something about this. And so a number of us from around the country formed this group called the Climate Psychiatry Alliance. And from that, we started doing things to try to move the major psychiatric professional organizations, the AACP and the APA in particular, to take on more, to educate people, to develop policies, to address this, and to work collaboratively with other health specialty disciplines to do the same. So the Medical Society Consortium on Climate and Health I've been involved with is doing terrific work. They have a great website. And within the APA and AACP, we've worked on things like getting the APA to divest from fossil fuels, which they've agreed they will do, to work on developing curricula. We now have a caucus on climate and mental health issues and a committee on climate and mental health issues. Ken Thompson's one of the members of that committee. So we're making a lot of progress, but there's a lot to be done. And obviously with the work going on with the Glasgow meeting and the slow progress in Congress, we're very concerned about whether or not we will be able to beat some of these deadlines. That's what motivates me. I'll stop at that. I don't hear anyone else. Are you all muted?
Wes, if you're trying to speak, you're muted.
My fault.
I-
My fault, David. I'm sorry.
I'm sorry,
And
we
everybody.
thought, Dave, that the microphone was open, but I was just saying your comments are well taken and really speak to some of the questions that Bob asked us all to consider today, not only what we can do personally and what kind of talents we can bring to this discussion, but also what kind of collaborative associations we can form and how we can use organizational activities to kind of promote this issue. I'm gonna turn things over to Bob now to introduce our panel, and I'm gonna hand you the microphone, Bob.
I got it. Thank you. I also have indication that Dave Dinich has a question and that Lauren Roth wants to make a comment. David and Lauren, would it be okay with you to hold the question and comment until we're mostly through our panels, because I don't want to get crunched on the schedule. Okay, David, Lauren, okay with you? Okay, great, thank you. David, great, inspiring, awesome,
Thank you.
humbling, informative presentation and powerful film, actually.